Anyone who deals with healthcare finance, well, you know the impact of fraud, waste, and abuse. It's a constant headache. But when you zoom in on something specific, like workers' compensation, wow, the problems, the sheer scale, it's kind of staggering. Okay, let's unpack this. Today, we're diving deep into exactly that, this pervasive issue of fraud, waste, and abuse, but specifically within the workers' comp system. We've been looking at a really insightful article. It's called Triple Threat: Healthcare Fraud, Waste, and Abuse in Workers' Comp, and it's published by Healthy Systems. Our goal here, our mission for this deep dive, is to break down what this triple threat actually means. Why is it such a big deal in workers' comp, and crucially, what's being done about it, and why should you care?
What's truly fascinating here is just, well, the size of it all and how it ripples out into the broader healthcare picture. When you connect this to overall U.S. healthcare spending, the numbers are just huge. Think about it. $4.5 trillion spent every year on healthcare in the U.S. Out of that, something like 25% is considered wasteful, just gone. And then on top of that, maybe 3 to 10% is estimated to be actual fraud. So yeah, it's not a small leak. It's a massive challenge for, well, for everyone paying the bills, government, private insurers, and definitely workers' compensation too. It's right in the thick of it.
Yeah, you hear those terms all the time, don't you? Fraud, waste, abuse. Sometimes people use them like there's the same thing. But they're not, are they? The article makes it clear they're distinct, even if they're related. So maybe we need some clear definitions to really grasp this triple threat.
Absolutely. Let's break them down. Starting with fraud. That's the big one. It's basically intentional deceit. Lying, essentially, to get a payment you haven't earned from a healthcare payer. And generally, it's a crime. In workers' comp, the article points to 3 main types. First, employer fraud that's huge, maybe $25 billion a year, like misclassifying workers to get lower insurance premiums. Then there's worker fraud, smaller scale, maybe $9 billion annually. But here's the real eye-opener. Healthcare provider fraud. This is where the massive money is. We're talking maybe $100 to $300 billion a year. Across all payers, public and private, it's by far the most expensive for workers' comp. Just to give you a sense of scale, in California, the average loss for a worker fraud case might be, say, $30,000. But these big provider fraud rings, they've seen average losses of $10 million per case.
$10 million per case. That's hard to even wrap your head around. It really shifts the focus from just individual workers to these, organized operations.
Exactly. It's often highly organized. Now, next up is waste. This is different. It's more about unnecessary use of services or resources. Usually it comes down to carelessness, maybe negligence, or just inefficiency, not that deliberate intent to deceive like fraud. Think about administrative waste, like clunky claims processes, bad documentation, or clinical waste, maybe ordering too many tests that aren't really needed, or poor coordination of care. And operational waste, too, like inconsistent prices for the same thing, or maybe using a super expensive drug when a perfectly good, cheaper generic is available. It's money just slipping away.
Right. Inefficiency rather than outright theft. Makes sense.
And the third one is abuse. This is kind of the middle ground sometimes. It involves not following standard protocols or best practices, and that leads to extra unnecessary treatments or costs. Now, abuse can be a crime depending on the intent and how often it happens, but it doesn't always have that clear intent to deceive like fraud. It might be about overusing services, providing things that aren't strictly medically necessary.
Okay, that clarifies things a lot. Fraud is deliberate crime, waste is inefficiency, and abuse is that tricky area of bending or breaking the rules, maybe without proven criminal intent, but still costing money. So knowing that, here's where it gets really interesting. Why is workers' comp specifically so vulnerable to this triple threat? What makes it such a target?
Right, that's a key question. And a big part of it is the structure. Workers' comp is state by state. You've got over 50 different systems, different departments, different rules, hundreds of insurers, thousands of providers, all operating slightly differently. That fragmentation makes it incredibly hard to spot suspicious patterns that might cross state lines or involve multiple players. It's just siloed. Plus, workers' comp benefits are often more generous than standard group health insurance. And insurers sometimes have less wiggle room to limit costs or deny services. That makes it, frankly, a more attractive target.
More money, less unified oversight. Sounds like a recipe for problems.
Exactly. And we've seen some pretty shocking examples. Remember that massive $200 million fraud scheme in California the article mentioned? It really exploited everything. Generous benefits, a vulnerable population of workers, many with limited English or understanding of the system, plus a complex, slow system with not enough oversight. What happened? Injured workers got pushed into treatments they didn't need, sometimes painful ones, like unnecessary spinal devices. Just imagine that. Harmed for profit.
That's awful. Just awful.
It really is. Another example from Florida, they had a pharmacy rule allowing free choice of pharmacy. Sounds good, right? But it got exploited. Some physicians started dispensing medications directly from their offices, often at inflated prices, led to huge pharmacy costs, and potentially patients getting meds they didn't need.
So it's not just old problems either. It sounds like new risks keep popping up, like you mentioned mental health.
Yes, mental health is definitely an emerging area. As more mental health conditions become compensable under workers' comp, which is happening, the risk grows.
Hmm.
Already, about 20% of general healthcare fraud is linked to mental health services. And then there's telehealth. Huge boom during the pandemic, obviously very convenient, but it's also created new avenues for fraud. We're seeing groups recruiting providers, offering kickbacks to prescribe unnecessary things, equipment, tests, meds, and tactics like upcoding billing for a fancier service than what was actually done, or duplicate billing, charging twice for the same thing. The fraudsters adapt. They always do.
It really is a moving target then. Even areas where there's been progress, like the opioid crisis. Vigilance is still key.
Absolutely. The opioid situation was terrible. At its peak, over half of injured workers got opioids. Many stayed on them long term. It was a huge factor in overdose deaths. Thankfully, that's decreased a lot. But pain management is still essential in workers' comp. And many common workplace injuries need things like diagnostics, physical therapy, medical equipment, what we call ancillary services. These areas are just ripe for fraud. Overuse, kickbacks, inflated bills. We saw examples like, $310,000 in fake translation services in California, or $80 million in inflated PT and equipment charges in Texas.
Wow.
These aren't just one-offs. They show how vulnerable the system can be.
And when we throw around these huge numbers, billions of dollars, it's easy to forget the real impact. This isn't just accounting. It's about injured people already hurting, trying to get better, and then maybe they get caught up in unnecessary treatments or their care gets delayed or compromised because of this stuff. That's the real tragedy here.
You've hit the nail on the head. The human cost is just devastating. Compromised care is a direct result. Workers getting treatments they don't need, maybe even harmful ones, like those spinal devices in California. There was that Johns Hopkins study, too. It found patients treated by providers who were later banned for FWA. They were significantly more likely to end up in the ER, even more likely to die.
That's chilling.
It is. It directly puts health and recovery at risk. And beyond the physical harm, think about the trust aspect. It just erodes confidence in the whole system. An injured worker is already vulnerable, and then they face this. It makes a bad situation so much worse. And those common fraud schemes really highlight it. Fake billing, unnecessary treatments, kickbacks, referral schemes, inflated charges for drugs or equipment. It all hurts the worker in the end.
So, okay, it's a huge, complex, evolving problem with devastating consequences. Bringing it all together then, what's being done? How do we actually fight back against this triple threat?
Well, it's definitely not simple. It takes a layered approach, a multi-pronged strategy, and a really critical piece is still human expertise. Claims adjusters, case managers, they're on the front lines. They often spot things that just don't look right, those anomalies. Then you have the more traditional data detection, using rules-based systems to sift through claims data, looking for known red flags, like upcoding or duplicate bills. That's been helpful. It catches a lot. But the schemes change, so the rules have to keep catching up. It's like playing defense all the time.
Right, like whack-a-mole. You stop one thing, another pops up. How do you get ahead of it? How do you play offense?
This raises an important question. How do you stay ahead? And that's what AI comes in. Artificial intelligence. The market for healthcare fraud detection tech is booming, projected to grow from about $1 billion to over $3.5 billion in the next decade, mostly driven by AI. Because AI, especially things like machine learning, can learn and adapt. It can automate finding patterns, not just the known ones, but potentially new types of FWA, much faster and on a much larger scale. The potential for saving money and, more importantly, improving patient outcomes is huge.
Okay, AI sounds promising, like really promising. But is it the silver bullet? Are there hurdles?
Oh, definitely hurdles. It's not magic. First, AI needs good data. Clean, relevant data, lots of it. And then there's privacy. Claims data has protected health information, PHI. So you can't just plug it into any commercial AI like ChatGPT because of privacy rules, big security risks. So organizations are looking at workarounds, building their own internal AI models or using specific types of large language models that protect that sensitive data. Plus, it takes real technical skill to build and manage these systems. And honestly, it takes time for everyone involved, insurers, providers, regulators, to trust the technology and work together effectively.
So AI is a powerful tool, but not the only tool.
Exactly. It's part of a bigger toolkit. The most effective approach, like the Healthy Systems article lays out, combines that evolving technology with essential human oversight and smart strategies. Think of it as layers of defense. You need that human vigilance, strategic planning, really vetting providers, ongoing analysis. You need smarter data analysis using rules, yes, but also advanced analytics and AI to flag risks, trigger interventions, maybe even educate claim staff in real time about suspicious treatments. And you need proactive measures. Things like prospective adjudication, stopping inappropriate treatment before it happens, not just chasing bad bills later. That's huge. Plus, ongoing audits, both automated and human-led. And making sure different systems can actually talk to each other securely. Interoperability is key to sharing information safely. It's a constant combined effort.
So what does this all mean for you listening in? Well, it means this fight against fraud, waste, and abuse in workers' comp isn't just some abstract financial thing. It's a vital, ongoing battle. And winning it helps contain costs for everyone, sure, but maybe even more importantly, it helps ensure the people who get hurt on the job actually get the quality care they need to recover. Just being aware of how complex this is, that's a powerful thing in itself.
This raises an important question. How does your understanding of these complexities help strengthen the system for everyone? It's about realizing that vigilance matters. Technology like AI offers new possibilities, but it has to be used responsibly, alongside human expertise. Protecting the system, protecting workers, it takes continuous effort. So maybe think about this. What more can you discover about how these systems are evolving, trying to stay ahead of the curve to protect both the money and the people within workers' compensation?